Do skincare products actually work, and should you be worried about putting toxic chemicals on your face? I'm Dr. Karan, an NHS surgeon, and in this podcast, we cut through the BS of modern health advice and tackle the biggest issues in science and medicine. The big fad right now is if you can't eat it, don't put it on your face. But how true is that really? Dr. Michelle Wong is a science educator, cosmetic chemist, and the founder of Lab Muffin.
Our body can't really tell if a molecule comes from nature or not. Nature has lots of things that are really harmful. It has lots of things that are really benign. And that's the same with synthetic things. Synthetic things can be really toxic. They can be really safe.
Within the natural versus chemical debate raging and all the promises of anti-aging serums, creams that reduce wrinkles, and products that cure skin conditions, we find out which skincare products are actually safe and do what they promise.
It's being sold as Botox in a bottle, and there's a reason Botox needs to be injected. Botox is one of the most toxic substances known to man. So if something in a bottle was working like Botox, you probably don't want that. Yeah, so there's a lot of overhyping going on.
Together, Michelle and I cover everything from the science of how skincare products work to the latest hype around new flashy ingredients and the dangers of DIY sunscreen.
So making sunscreen at home is really hard. You just don't know what's happening on a microscopic level. You could have tons of holes in your sunscreen film that the UV is getting through.
And Michelle has an actionable guide for anyone looking to up their skincare routine without spending a fortune. Enjoy! Just tell me a little bit about yourself. Like how long, like you obviously have a different mindset and style when it comes to attacking content which promotes misinformation or anything online, as opposed to maybe say a dermatologist who is looking at things from maybe a clinical point of view, and this is what a patient needs to improve their skin, etc. But you've got this expertise in the cosmetic side and the chemical side of things. You actually can analyze things on a far deeper level. So how do you look at content? And when you see skincare influencers, and there are millions of them online, what do you think of when you see all of this and people just talking about chemicals willy-nilly?
Well, I think on the one hand, skincare influencers have a really important role. I think a lot of the time with skincare and other sorts of personal care products, the product is more than the sum of its parts. Like the ingredients go in and then they will interact with each other. So you can't really read an ingredient list and then predict how that product will work. So I think influencers have a really big role in reviewing products, talking about their own experience with products so that people can find products that are likely to work for them. But then on the flip side, sometimes you see influencers and they talk a lot about chemicals and which ingredients to avoid and how they work and what they do and all these rules that don't really exist. And that really annoys me because, it is partly because my background is chemistry. So I first started getting into the science of beauty products back when I was doing my PhD, which was in medicinal and supramolecular chemistry. So in the lab, I was looking at how different ingredients would interact with your body. And then I was trying to buy products for myself and trying to go down this rabbit hole. And back then it was 2011 when I started my blog. I think I'd been researching this sort of thing for a couple years beforehand. And it was just confusing. There wasn't that much online. And a lot of it was just marketing. It was just all this really vague stuff like this product will add radiance. And I was like, what does that even mean on like a technical level? What is it doing to my skin? So I started diving down that rabbit hole. And then I guess over time, we got social media. We got more and more social media, really. We got more video content. And so I've been around for a really long time and I've just seen a lot of different trends. But yeah, influencers have a big role. I think they are important. Reviews are so important, but sometimes they overstep and then it gets to a point where people are more confused and they're not being helped by this content.
And given the rise of the number of people having complex and even sort of middle grade skincare routines, the number of skincare influencers, and people just talking about their own experiences of skincare online, does skincare actually work in the sense of, can we confidently say that every single product that exists out there that's available to buy is actually workable? Does it actually do what it says on the tin?
Okay, so technically, everything should do what it says on the tin because we do have false advertising legislation. But a lot of the time, the marketing, it will suggest something. It won't outright say it or give the idea that it does something. And it might not actually do that. So it's a bit tricky because we have, in most places, products are divided into drugs or cosmetics. So drugs or medications, they are allowed to go in and treat disease. They can change the structure or function of skin. It depends on which country you're in because sometimes some things are drugs in one country and cosmetics in another. But for example, in most countries, tretinoin, which is retin A, it's a vitamin A derivative. You can sell that as something that reduces wrinkles. It has anti-aging properties. It can reduce pigment because it's a drug. But then you have other products which are cosmetics. And so even if the science says that they can do something, they can't claim that it does. So there's an ingredient called retinol that's in a lot of cosmetic products out there. It's in lots of skincare products, and it turns into tretinoin in your skin. So on the face of it with the science, it does pretty much exactly the same stuff as tretinoin if you use enough because it turns into tretinoin. But it can't claim that it does what it does because of these regulations. Like our skin is complex. It doesn't quite obey this like sort of very black and white legal framework. So when you're reading ingredient lists and reading ingredient claims, it's pretty tricky. The marketing both needs to oversell and undersell the product. And so it just makes it really tricky for consumers to work out what the hell is going on.
And obviously, given all of these products, and these products aren't just simple one ingredient things, there's several ingredients in them, sometimes maybe even hundreds of ingredients in them. And for the average person, the layperson, just looking at these things, it might sound quite scary that there's a number of these chemicals in skincare products, which then claim to improve your skin and keep you healthy, for example. Like even sunscreen may have, dozens of ingredients inside them, which have complex chemical names. But ultimately, even our own natural skin produces all of these complex compounds and hormones and chemicals, from hyaluronic acid, which people would have heard of, peptides and sebum, and all these chemicals that the skincare companies use to create their products are basically just sort of clones of our natural chemicals that we produce, right? How do these companies come up with more and more fancy ingredients and fancy products? Where's the inspiration behind all of that?
That's a really good question. So like you said, a lot of the time it is stuff that's already in our skin. Hyaluronic acid is in there. Vitamin A is already in our skin. So those are going to have, I guess it depends. Like sometimes we put them on our skin because our skin is lacking. So for example, in winter, you might shower a lot and then you lose a lot of those natural moisturizers in your skin. So you use a moisturizer to replace them. Sometimes you're trying to do more than what your natural stuff does. So vitamin C, for example, it's an antioxidant. It's really good at neutralizing free radicals. Free radicals are things with unpaired electrons that are really reactive. Once they're in your skin, they can start messing up lots of different things. They start reacting with proteins and DNA and essentially making your skin age faster than it should. It causes cumulative damage. So with vitamin C, you've already got some in your skin, but it's not that much. If you put more vitamin C on your skin in the form of a skincare product, it can get in there and help or have more of that antioxidant action, buffering those free radicals more than the natural stuff does. And then you also have the ingredients that are brand new. So these brand new ingredients, a lot of this, the way they discover them is very similar to drug discovery. I mean, it's kind of the same thing, which is what I was doing in my PhD. Basically, the way that different ingredients work in our skin is just like with any other drug. The drugs are molecules. They go in and they bind to receptors. It's sort of like a key inside a lock. And once it gets into the lock, it can send signals to the rest of your body to do things like, for example, produce more collagen. So the locks have a particular shape. Different keys will work well in those locks. And so a lot of the time, there'll already be a molecule inside your body that fits into that lock. So a lot of these new molecules, they have very similar shapes and properties to the ones that we already know work in the lock. So if you start tweaking the key, start like adding little things, removing things, making it a bit more water soluble or oil soluble, that kind of thing, then you can start testing it against things like cells to see whether it has more of an effect or it has the opposite effect. And that's sort of how you slowly get towards an ingredient that is brand new that does something on your body.
So given that obviously there are some natural ingredients that these products take inspiration from, but also these synthetic chemicals as well, what really is the difference in terms of, is there any significant harm that the average consumer should worry about from having potentially synthetic chemicals versus natural ones? What is that? Is there a cumulative risk of harm, or are they just things which have almost an inert effect in terms of cumulative damage?
It really depends. So, our body can't really tell if a molecule comes from nature or not. Nature has lots of things that are really harmful, it has lots of things that are really benign. So, I mean, we are constantly in contact with all the chemicals inside our body, which are mostly natural. So, those are all clearly benign to some degree. And then, I mean, I'm from Australia, so we have snakes and spiders, lots of poisonous stuff that can kill you. Like, nature is both scary and not scary. And that's the same with synthetic things. Synthetic things can be really toxic, they can be really safe. And there are toxicologists who look at all the different ingredients that are used in products, both natural and synthetic ones, and they look at how dangerous they are. So they look at what sorts of possible harms they can have. A lot of this is based on animal testing, but there's also newer methods which involve things like cells that don't actually involve live animals. And then they look at what percentage does it cause harm. And then the allowed recommended percentages that are used in products are usually less than 1% of that. So yeah, there is a process going on behind the scenes that makes sure that the products we're using, based on the current evidence, they are not going to be harmful to our health.
So, looking at some of those products you just mentioned, and you mentioned there's obviously such a minuscule proportion or percentage or parts per million or whatever, however you like to define it, of a certain chemical in a product. So, even if, for example, a chemical was linked with cancer or was termed by the World Health Organization or IARC classifications as carcinogenic or possibly carcinogenic, it's in such a small amount that even if you were to use such a product for every single day for months, for years, it would unlikely to give you a clinically significant increase in your cancer risk, as opposed to, I don't know, exposing yourself to just raw UV radiation, right?
Exactly, yeah. And a lot of the time, when you see these scare stories, they're based on studies which were actually used to ensure safety. So, the reason that study was done in the first place was to see at which point you start having a dangerous effect, so that then they could make sure that the amount they're using isn't going to cause that effect. But then you have lots of websites who are just misinterpreting this data and thinking that that means it's dangerous, when in fact, it's almost completely the opposite.
And I see now an increased number of people, particularly online. I don't know if this has been going on far longer, but it's just more visible now because of the online spaces. But claiming that a product that you should be using on your skin should also be edible. And I think this also links back to this naturalistic fallacy where natural is good and synthetic and chemicals are bad. And so, for example, if you're using soap or if you're using sunscreen, it needs to meet one of two criteria. Either you can make it at home yourself, like a DIY sunscreen, or your soap or sunscreen should be edible. So whatever you're consuming is also safe for your skin. I mean, just reading that statement or listening to that statement and that idea, it seemed bizarre. But why is that actually harmful? If someone could make sunscreen at home, why shouldn't they? And why is that a terrible idea?
So, making sunscreen at home is really hard. Sunscreen is actually honestly kind of a scientific miracle. Like, if you think about what it's doing, it's like a layer on top of your skin. Your skin is moving, you're sweating, you're like putting out oils all the time, and somehow this layer is blocking so much UV. It's blocking, I mean, if it's SPF 50, it should be blocking, if you're putting on enough, blocking all but 2% of the UV that's coming in. And UV, it's cosmic radiation, basically. Like, the sun is just blasting this stuff. It's going through kilometers and somehow it hits us and it increases the risk of skin cancer. Like, it's amazing that this really thin film does that. And to get that thin film to do that, the sunscreen ingredients have to be spread out really nicely and they have to stay spread out. So if you think about, let's say you have a blob of paint. If you have a blob of paint and it's just sitting on the surface of a piece of paper, that blob of paint isn't blocking most of the paper. Like, how sunscreens work, it's basically like paint, except instead of absorbing colored light, it's absorbing UV. So if you have that blob of paint, it's only covering a little bit. If you spread it out, you can make it cover the whole sheet of paper. And that's exactly the same with the the UV absorbing ingredients in sunscreen except on a microscopic level. So if you're trying to make a DIY sunscreen at home, you don't know if the zinc oxide, which is the main thing people are using in their DIY sunscreens, you don't know if that is in a microscopic clump or if it's spread out. There's just no way of testing that easily at home. So yeah, you just don't know what's happening on a microscopic level. You could have tons of holes in your sunscreen film that the UV is getting through. And in reality, the stuff that you have at home, like the hand mixers, or even I've seen people just using spoons, that's not enough to get the zinc oxide to declump. Like it loves clumping up. So that is just a terrible idea. With the whole edible thing, I'm sure a lot of dermatologists would probably just laugh at that because one of the big problems that they see a lot in summer is people will get lime, they squeeze it in their beer, and then they go out into the sun. And lime peels actually have an ingredient in them called furocumarin, I think.
Like some sort of sorolins?
Yeah, exactly. Yes. So these are phototoxic, and that means that when they're in the sun, they react with your skin and they give these horrific blisters. Like you can look it up, just look up, I think it's called phytophotodermatitis.
Yeah.
You'll just see pictures of people with blisters as big as their thumbnails, and it's messed up.
Yeah, I think I've seen a trend where people try to use some sort of citrus fruit to dye their hair in the sun. They squirt this lemon juice on their hair, go out to the sun, and that's going to supposedly bleach their hair. And I guess it might have some effect, but also, like you mentioned, the risk of phytophotodermatitis and burns and blisters is probably not worth the risk. And I just wanted to double down on what you were saying about this homemade sunscreen and how it's probably not going to be mixed properly. You can't control the quantities and the molecular size of the different sort of zinc oxides that you put in there. And I guess it would be analogous to, you using an umbrella which has loads of holes in it. It might work to some degree, but it's really not helpful and it could be harmful as well. And I think, when it comes to sunscreen, I also see a lot of this worry and fear, which has actually been going on since the early days of Facebook. And it seems to have reared its ugly head again, where there is this real lack of understanding. And when someone says the rates of melanoma have increased in the last few decades, and they've correlated the increase in the melanoma rates with us using more sunscreen, ergo, sunscreen use has directly been linked to melanoma risk. And again, feeding into that belief that the sun is good, which again, I'm not arguing it's not good, but the sun, we're kind of depriving ourselves of this magical source of power from the sun, and we're blocking it because of sunscreen, and that's leading to disease and all this kind of bad things going on. I mean, why is that a myth that's been propagated so often? And I mean, are there actually any dangers of sunscreen?
Okay, so first off, with the whole increasing trend, I've seen a whole bunch of videos on this, and I mean, the thing is, correlation isn't causation. I mean, there's really only largely three big trends you can have. Increase, decrease, stays the same. And you can pick so many things that also correlate with the increase in melanoma. It's not just sunscreen use. It's also, I think I looked up, there's a particular name, might be Martha in the US. The number of people born with the name Martha has also, has a really good correlation. There's actually a website called Spurious Correlations where you can upload a correlation and then look for things that correlate with it. Upload a trend, look for things that correlate with it. It's a great site. But yeah, you can see a whole bunch of things. It's sort of I think it's climate change and number of pirates or something. There's tons of stuff like that. So yeah, that's one of the reasons for that. So the reason melanoma has increased, there's a bunch of reasons. And the big ones are detection has increased. So we're getting better at spotting melanomas earlier. And you can actually see that the death rates from melanoma haven't increased anywhere near as much as the detection. So that's a big sign that we're actually finding them earlier. It's not an actual increase in how severe they are. And finding them earlier is a good thing. So that's a reason it's going up that we should be happy with. There are also less happy reasons. So there's the fact that it's a lot easier to travel overseas now. So you have all these people who are sitting indoors in their offices for most of the year, and then they have their 2 weeks of holiday. They go lie in the sun, they get roasted. They forgot their sunscreen, but it doesn't matter. They're on holiday. And then that sort of really intense exposure is one of the big triggers for skin cancer. So there's lots of things like that. There's also things like we don't live where we used to live. There's a lot more migration. So people with lighter skin color are living in places with a lot more sun. There's trends like tanning. Tanning wasn't as popular 100 years ago, for example. In terms of the worries about chemical sunscreens, or really everything, everything has risk. That is just a fact of life. Even if you think water doesn't have risk, there is a risk. Like you could trip over and then it could go up your nose, you drown in your glass of water. But that risk is really small. We distinguish in chemistry a lot of the time between a hazard and a risk. A hazard is something that can happen, tripping over, drowning in your glass of water. The risk is more about how likely it is. And that's usually based on a bunch of things when it comes to ingredients in our products. It's based on things like exposure, how you're exposed to it, how much you're exposed to. So drop of water versus a giant swimming pool of water, like one is obviously more likely to make you drown. How you're exposed to it, like if you splash it on your hand versus down your lungs, then of course, very different. And it's the same like that with any ingredient. That's why we have toxicologists who calculate what the risk is of all our different ingredients, and in particular, chemical sunscreens and all sunscreen ingredients, because they are drugs in a lot of countries, in the US, Australia, and I think Canada as well. And then in a lot of other countries, they are special cosmetics. Like they are in a special category that gets regulated a lot more strictly. So there are toxicologists reassessing the safety all the time. If there's a concerning study that comes up, they go deep into that and check that against all the evidence and check that it is still considered safe. So yeah, in the EU, for example, in a lot of Asian countries, it is regulated as a special type of cosmetic. So there are risks involved, but the risks, because of these limitations, because of these regulations, and because of the fact that these ingredients need to have a portfolio of safety data that gets submitted before they get approved as a sunscreen ingredient, they are very safe. I think the latest, like region-wide safety assessments for chemical sunscreens were done maybe 4 years ago. It's actually still an ongoing process. So the EU has been releasing them from, I think the first one in this batch was 2021, but they're still releasing them over time. I think it's like every 3 or 6 months a new one comes out. So there is this ongoing process where regulators in the background are trying to make sure that our products are still safe.
And I guess there's also one main other worry that I hear a lot on social media and from other people about sunscreen, and it's regarding vitamin D deficiency. There's this commonly held belief that if you wear sunscreen, you're depriving your body's skin the ability to harness and produce more vitamin D, which I guess on a mechanistic level makes sense because our skin needs the sun and produces vitamin D from our skin, our little skin chemical factory to produce vitamin D based on that. And if we cover our skin with sunscreen, that limits the ability. But again, obviously, we don't really need much sun to maximize our skin's vitamin D potential. So where is this myth coming from and why is it actually wrong?
Yeah, so this idea that sunscreen reduces vitamin D, like you said, it makes sense on a mechanistic level. The UVB that does cause sunburn, that also converts vitamin D in our skin. It produces vitamin D from its precursor. So you would think blocking UV should reduce that. The thing is, we are really bad at wearing sunscreen. Most people don't apply enough. You can't get it on everywhere. Like you've got, I don't know, between your fingers. I think the eyelids are also a place where a lot of people miss. Your scalp as well, tons of places where we can produce this vitamin D. And because vitamin D, it's not like location specific, it gets produced in your skin and then it goes to the rest of your body. It doesn't really matter where you produce it as long as you're producing enough. So that's pretty much the main reason why all the current evidence shows that it probably isn't decreasing vitamin D to any big extent. Now, there is a clinical trial happening in Australia. I'm not sure if it's quite finished yet, but it's literally happening currently. It's actually by the same people who did the original studies on sunscreen, the clinical trials that show that it decreases skin cancer. They're looking at whether sunscreen use decreases vitamin D production. So hopefully that will be out in a few years and give us a more definitive answer. But based on the current evidence, it doesn't. Now, what does seem to correlate with it, though, is avoiding the sun, like actually staying indoors and also putting on more clothes. Clothing is actually really good at sun protection, mostly because there's like less user error involved. You can't like under apply clothing. I guess you could wear like clothing that's too thin, but yeah. So earlier this year in Australia, they released a sun exposure guideline, which actually gives you an idea of how much sun you need based on your skin color, based on how much clothing you're wearing. And they calculated how long you would need in the sun for a lot of the different capital cities in Australia. And it's really interesting. So if you are concerned, I highly recommend reading that and getting an idea of what's going on. But in general, the guideline for lighter skin is if the UV index is 3 or over, you should be using sun protection, and that shouldn't decrease your vitamin D levels. If it's 2 or below, then you don't need to use sun exposure. You don't need to use sun protection, and it's a good idea to go outside and get a bit of sun. The amount of sun, again, if you look at these Australian sun exposure guidelines, it's really small. And then in some places, you actually need way too much sun exposure to get to that level of vitamin D production. So there are situations where it's a better idea to just take vitamin D supplements rather than trying to expose yourself, because it's just, I mean, it's almost impossible for some people if your skin is really dark and you have really low UV. So a better idea is probably, if you are concerned, if you do have darker skin and you're in a place that has less UV, go to your doctor and get your vitamin D levels checked.
I think you've touched on a really interesting point here, which has a lot of nuance. And I think I came across this same study as well, but from a different angle, more looking at the requirement that everyone says you must use sunscreen every day. And I actually read this study and then found out only this year that you can look at the UV index on your mobile phone. I never knew that. If you go on your weather app and then you keep scrolling down, it gives you the UV index for the day on your phone. I didn't realize that was there. And yeah, like you said, in that study, UV index of 3 or more for most people, probably wearing sunscreen, unless you have certain, darker skin types. Like for me, for example, maybe I should only be considering wearing sunscreen if the UV index was maybe more than 7 or 8 and I was in the sun for prolonged periods of time. And I think, again, the issue about sunscreen is there's two things, right? There's UV rays increasing your risk of cancer versus UV rays increasing risk of photoaging and just aesthetic damage. Now, if I didn't care about photoaging and the sun making me look older and I only cared about the skin cancer, if I'm in the UK where it's probably UV index 1 to 3 most of the year, do I need to wear sunscreen every day? Probably not, right? But if someone, like Caucasian person, probably yes, they should wear sunscreen on a daily basis for both the skin cancer protection and the photoaging if they were concerned about that.
Yeah, exactly. There is a lot of nuance around it, and a lot of the stuff I've been seeing online lately about it, I don't think they realize that Australia has had these UV index guidelines for at least, I think, 10 years, maybe more. I've seen a lot of things that are saying like scientists have only just realized the benefits of sun, and it's like, not really. We've actually known this for a while. I think they're trying to manufacture outrage, honestly. But yeah, the UV index is really handy. I highly recommend looking, like, even if you're not in Australia, the guidelines kind of give you a really good idea of the nuance involved and the fact that it's pretty much like if you need sunscreen, you want to max it out. If you don't need sunscreen, like, then give yourself a little bit more room. But a lot of the time, the stuff I've seen, like, people are saying you need to lie in the sun for half an hour. And these are like really pale people and they're wearing barely anything. So I assume it's quite warm. There's quite a high UV index. Like, that just really isn't necessary. And it's probably doing more harm than good in that case.
And, right now we've spoken about chemicals and what does work, what doesn't work. One specific chemical, which I've heard about for years, and it was more of like a fringe hippie thing before. And now it seems almost like there's a greater appreciation for, maybe it does actually work and there's more science, and that's collagen. And, from my just sort of amateur interested research over the years, looking at does collagen actually work to improve someone's skin, it looks like the bulk of the published studies out there were funded by industry, by manufacturers of collagen products. So there's some inherent bias, funding bias and publication bias there. But actually, if you look at the science, is there anything to say that, yes, without a doubt, collagen supplements do improve the skin? And not just from a subjective point of view, from an objective clinical outcomes point of view, can we say at this point in science, collagen does work?
I would say no. So there definitely is some science there. So one of the common things I used to see was the idea that collagen, it's just a protein. It goes into your stomach. It breaks down into amino acids just like anything else. It absorbs, and then it's just like any other protein. You shouldn't be paying too much for it. But there does seem to be evidence that because of the specific amino acids in collagen, there's a special one called hydroxyproline, which is basically not found in any other protein. That seems to be able to send different signals to your body. So that part has been solved. But then, yeah, the clinical outcomes part is a lot sketchier. Like you said, a lot of the trials were done by the supplement companies or just sponsored by the supplement companies. A lot of them are done in conjunction with universities, so there is a bit of independence there. But overall, I don't think it's really showing that much of an improvement. But yeah, so if you look at what the outcomes are compared to something like using a moisturizer, it's kind of similar, and moisturizers are a lot cheaper. They're also less risky because supplements are quite unregulated. You don't really know if they're going to be contaminated with heavy metals, which has been a problem in the past. So I generally tell people, like, if you want to try them, you can, but you should probably look at some more effective and cheaper options first, like using a sunscreen, using a moisturizer, maybe using some basic anti-aging products like retinol or tretinoin. And then if you still want more and you can afford it, then you might want to add on collagen supplements.
So, just similar to how the collagen industry is a little bit shaky and we can't say for sure, yes, it's definitely going to improve your skin, are there any other chemicals and ingredients available in products out there that are potentially overhyped and are mired in that bit of gray area where it's probably not worth your money?
Oh, there are so many. I would say most of them are, honestly. Like, most of the time when I see an ingredient and it's been popular for less than a year, I generally assume it doesn't do much. Like, it's one of those nice to have things. So again, yeah, check
Hmm.
if you're doing all the basics. And then if you want more, if you have a bit of money, if you want to try experimenting on yourself, which is kind of fun, like trying new products is fun, then maybe go for it. So a few of the ones that have come up recently, bakuchiol is one. Like, it's sold as like a retinol alternative, but it's honestly like, if you look at the evidence they're showing, it's pretty sketch. There's also a lot of stuff about stem cells, which I think has been going on for a
Hmm.
while, and they're always stem cells from other species, which won't really work the same. It'll be things like apple stem cells. I think, like, the argument is that they have ingredients in them that work like any other ingredient. They're just using the stem cell name to hype it up. But yeah, that seems to be quite overhyped. I keep seeing people say hyaluronic acid is overhyped, and I feel like
Hmm.
it isn't. I feel like people are just a bit salty about it being in everything. Same with niacinamide. Like, they are two ingredients that actually have a decent amount of evidence behind them, but they're in everything, and some people are sensitive to them. So yeah, people just are pretty angry about them being in everything, which I totally understand. Peptides are a
Yeah.
really trendy ingredient. But the evidence on them is really varied. Like, a peptide is a chain of amino acids, and there are lots of different chains of amino acids. It's like, I know, putting letters together to make words. Like, it's like words. They're all very different. They do different things in your skin. Some of them have decent amounts of evidence, like Matrixyl 3000, I think it is. I think that one's the one that has the most. But then, like, there's a lot of marketing involved. There's a bunch of other matrixyls, which have a lot less evidence for them. There's one, I can't remember which one it is. It's being sold as Botox in a bottle. And there's a reason Botox needs to be injected. You're not getting it in a bottle. And Botox itself, like, it's got the word tox in it. Like, Botox is one of the most toxic substances known to
Yeah.
man. It causes botulism, which is like, it literally freezes your muscle so much that you are in a medical emergency. So if something in a bottle was working like Botox, you probably don't want that.
No.
Yeah, so there's a lot of overhyping going on. But yeah, I think most things, they usually have random exotic ingredients. Like, they try to say
Hmm.
things like, this comes from like an Amazon rainforest or something, and those are usually
Just
pretty
a marketing
sus.
ploy.
Yeah, there's a lot of marketing, so much marketing.
One trend I've seen increasingly, and this is not just with skincare, it's with most products and most industries. And I think it's almost a hat tip to consumers becoming slightly more savvy, where people try to science wash their products and become more evidence based. And they throw out these buzzwords to almost bring down the fear levels of the user, to say this is evidence based or this has this or clinically tested and clinically proven. And that also has this crossover with this clean beauty trend that I think you've spoken about online, where again, we're getting rid of all of these chemicals. It's all natural and it's great for you. You can use it and it's nothing to worry about. And I think one of the things I saw you mention online was about the parabens. And parabens have been fearmongered and demonized to no end online. Is there anything wrong with parabens? And why is overly demonizing one product actually, in essence, cutting off our nose to spite our face because it might bring even worse products on the market?
Yeah, so parabens are they were some of the most commonly used preservatives. And there was a lot of fear mongering about them. I think the very start of it was probably 2004. There was a study where they found parabens in breast tumors, like breast cancer tumors. The problem is that study was kind of trash. So if you actually look at the study, they only looked for, they didn't compare it against normal breast tissue. So there could have been parabens in that. But on top of that, they actually found parabens in the samples that didn't have breast tissue at all. So these were the blank samples, the ones that just had the things that they were floating the cells in, essentially. So it seems like the parabens were actually in their chemicals, like the scientific chemicals they were using, rather than actually from the breast cells. So that started a whole bunch of fear mongering. And yeah, nowadays it's actually kind of hard to find parabens in products. A lot of the time as well, people are pointing towards studies on parabens and how there's so many more studies showing the dangers of parabens compared to other preservatives. And a lot of that is just because parabens were really popular. That meant that people were studying them more. If you study something more, you're going to get more studies on it, good and bad. And then you're going to have a longer list. And that was really the genesis of why everyone became scared of parabens. But the reason that they were so popular is because they were really good. So first off, you didn't have to use very much to get that antibacterial, antimicrobial effect. So preservatives are in your products to kill bacteria if you have bacteria in them. If you go back to like the 1950s, before preservatives were so widespread, you'll see that there's actually a lot of really scary studies or case studies where people actually had things like they lost eyes. There were babies in particular hospitals who ended up dying because of using contaminated products. So these days, a lot of people think that we don't need preservatives because we're kind of taking them for granted. We're kind of taking it for granted that we're not going to put a moisturizer on our skin and end up with an infection. And that's because preservatives have done such a good job. So the problem now is parabens, they worked really well because they're in such low quantities. They're not very irritating. They don't cause a lot of allergic reactions. But because everyone started fear-mongering about them because of this excess of data we have on them, which is actually a good thing when it comes to safety, that's the data that toxicologists are using to make sure we're using them safely, they're switching to other preservatives. And on the surface, these kind of look better because there's just less studies showing that they're bad, but a lot of that is just because they're not studied as much. So one of the preservatives that became really popular as parabens were being demonized, there are actually two, and good luck to me to say them, methyl isothiazolinone and methyl chloroisothiazolinone. I think those are it, but MI and MCI, they are really common allergens. I think something like, 5, 10, I can't remember the exact number anymore, percent of the population is allergic to them. I am one of those people. I'm not allergic to much, but I am allergic to those. And one of the things about them is that they cause allergies as you're more exposed to them. So there are a whole bunch of papers in the literature that have the word epidemic of allergy in them, talking about this massive rise of preservative allergies because these other preservatives were being used before they were properly investigated for these allergenic effects. So yeah, sometimes if you get rid of the parabens, you either get infections or you get massive allergies because you're switching to something else because those were necessary ingredients. And yeah, it's called regrettable substitution. And it happens a lot with ingredients.
And I think, I mean, correct me if I'm wrong, but also one of the worries about these specific ingredients like parabens and the link with, breast cancer and various other cancers was this worry that any of these chemicals that we put on our skin would be absorbed transdermally. And obviously, a lot of the chemicals or skincare products that we do put on our skin will experience some transdermal absorption. But is that even a worry to concern ourselves with?
It's not really a worry for us because we do have toxicologists checking this stuff, but it is a worry to toxicologists, and that's why they check this stuff. I think one really reassuring thing is if anyone is feeling the urge to be extra nerdy, you can look up some of these toxicology assessments, and you can actually see all of the steps that they go through to try to assess whether or not something is safe, like what they're checking. So it's always things like they'll check how much absorbs through skin, and then they'll go, okay, so they've measured a range in different studies. We're going to go with the top number, and then we're going to see how much you need in I think usually they use pregnant rodents. We'll see how much is going to affect the fetus inside this pregnant rodent. These days they use less animal studies. It's usually tiny changes in cells, and then you'll see how many layers of worst case scenarios they build into these assessments. If you don't want to read one of these, I do have a YouTube video on this. I think it's called something like US Sunscreens Aren't Safe in the EU, where I go through one of these EU safety assessments for oxybenzone. And you can see that when they lowered the lab percentage from 6% to 2.2%, they were really, really playing it safe. And then, so the reason I made that video was because they did change it from 6% to 2.2%, but the US stayed at 6%. But if you go through all of the reasoning they do, you'll see that it's actually probably safe at 1,000%. They've just limited it to 2%. And then so 6% in the US is really not that scary when you probably need 1,000% to have an effect.
Given the wide range of skincare products available and so much information out there, just like when I recommend that the average person going to the supermarket should just become more savvy looking at the ingredients list to look at the fiber content of food or, to look at what sort of things are in there just to learn more about food labels. I guess how can someone buying skincare products and beauty products, how can they become more ingredient list or label savvy just to improve their own understanding of things which it includes and things which could be useful? Like, for example, hyaluronic acid and niacinamide you mentioned are useful. How can they be improving their own understanding of this kind of skincare jargon and landscape?
I think firstly, you should look for good sources and check which sources are good and not. So me? No, I'm kidding. But I do have a book out, which I should really remember to promote sometimes.
No, we're going to put this in the podcast links and descriptions.
Thank you. But yeah, check your sources. So one of the important things to check for is relevant expertise. And I always tell people to look for the consensus of relevant experts. So for something like skincare, the experts are people like dermatologists, but not only dermatologists. I feel like they tend to sometimes be the only stop, but also chemists, toxicologists. There's lots of different scientists who might be involved in skincare. So looking at the consensus of them, that way if you have one of them who's gone off the deep end on a particular topic, you can check that what they're saying is actually likely to be something that other people agree with, other experts who understand the science. Also, there are some apps out there which look very scientific, but they're not. The Yuka app, the EWG app, I think Dirty is another one. These are ingredient scanning apps, and they are not scientific. They're some of the ones that just put up a list of studies and they go, this is dangerous because there are more studies. So definitely avoid those. The alternative to that, I think CoSmile is the one that's put out by the EU, and it's got very sensible descriptions of what ingredients do. And I think learning the ingredients is quite handy for that. There's also a site called Inky Decoder, which they do have ratings which are good and bad, and it is put out by someone who owns a skincare brand. But generally, it's good for just getting general information on ingredients, but you should still take it with a grain of salt. And again, look for the consensus between that and the CoSmile app. If something looks shifty, then maybe look for a few other sources.
if someone was brand new to the skinfluencer, skincare kind of world and wanted to build a very basic science-based skincare routine, which actually works and isn't way too fancy and has all the basic chemicals that actually do the job that they say they do, what would they use to build? And naming a few items that someone could go into pretty much any shop or online and just buy those things and use them religiously every day to have a good effect. What would they be?
Okay, so I would say that everyone can benefit from a sunscreen. If you have any sort of, first off, it is an anti cancer product, but also if you have any sort of skin concern, like whether it's wrinkles or uneven pigment or even acne, then a sunscreen can help. So start with a sunscreen. You're looking for something that you enjoy using, that you can use a lot of every day. You want to make sure that you use enough because it's like paint. If you don't have enough paint, it's not going to cover your skin adequately.
On this sunscreen thing, two questions. For the average person, how can they tell the difference, and what is the difference between sunscreen and sunblock, and a lotion versus spray? Which one is better?
Okay, so sunblock is no longer used anymore, but usually that refers to mineral sunscreens versus sunscreen, which is usually referring to chemical sunscreens. The difference between them, there's a lot of stuff about safety, but they're both pretty much safe. If you buy it in a shop, it is going to be regulated. It's going to be under those regulatory limits. So really it's about like preference. Chemical sunscreens are usually lighter in texture, but some people are allergic to particular ingredients. If you're in the UK or EU or Australia, or Asia, then you tend to have a wider variety of ingredients, so you're less likely to be allergic to them. In the US, there's a lot limited ingredients, which means that if you're allergic to one, then it's probably in a whole bunch of your products. So look out for that. Mineral sunscreens, they tend to feel heavier. They tend to be a bit drying, which some people like. They also tend to give a white cast if your skin is like any type of moderately dark. Like I get a white cast with most products if I use enough. So yeah, if you like them, that's fine. Just make sure you use enough. But most people probably prefer a chemical sunscreen. In terms of the format of the product, lotions/creams are always the best. Sprays, I did a bunch of experiments lately about how much spray you actually get on your face if you spray directly at it, and it's really low. I think I've estimated like most people are probably like getting 1/5 or like 1/15 of that product onto their face, which is pretty sad. Like if you're buying a product and you're actually only using 1/5, that is a ripoff.
Yeah.
So yeah, creams, you can get it all on your face. Even mousses are quite good. So mousses, you can get them all on your face. But yeah, generally sprays aren't very good. Powders aren't very good. Sticks can be okay. But because they tend to be made of waxier ingredients, they feel a lot thicker on your face. So usually that's better for reapplication. Apart from sunscreen, you probably want a cleanser to get rid of the sunscreen off your face at the end of the day. And then if your skin is dry, probably a moisturizer as well. So if your skin feels tight, moisturizers are great. Most sunscreens have moisturizers in them, so it's quite possible you won't need a separate moisturizer. Then if that's already pretty good, then that is like all you really need to get really good skin that will stay really nice as you get older. If you want more, then you might want to start looking at a few other products. So usually the next thing, different people have different opinions, but usually the next thing I recommend and popular recommendation, a chemical exfoliant. These are products that will start helping your skin cells, the dead ones, detach a bit faster from the surface. Usually that tends to slow down and it causes a bunch of problems like it can clog your pores, which leads to acne. It can make fine lines look more accentuated. And speeding up that detaching of your skin cells also helps fade pigment. So helps a whole bunch of things. Chemical exfoliants, there are some really inexpensive ones available. So you're looking for ingredients like glycolic acid, lactic acid, salicylic acid. Then usually the next one, sometimes this is the first recommendation from some people, is a vitamin A product because again, vitamin A just ticks off a whole bunch of boxes. So retinol, if you want to go into the more like pharmaceutical options, there's also tretinoin, adapalene, tazarotene. Those ones you'll need to see a doctor or a dermatologist, but retinol, retinal are available just from the chemist or from the supermarket. Then after that, it's like vitamin B, vitamin C, what else is there? For extra hydration, then you might want hyaluronic acid. There's a whole bunch of like other ingredients after this, and it really depends on what your skin concerns are. And usually, I recommend that people check what their skin concerns are before they get swept up in the hype of all the many, many products out there. So just keep in mind what you want to kind of tackle on your skin. Do you want to even out pigment? Do you want to reduce fine lines? That way, when you see an influencer gushing about a product, you don't go, "Oh, I need to get that." You go, "Does that actually address my needs? Will I benefit from that product, or am I just going to spend a whole bunch of money on basically a dream?"
One aspect of all of these things is, okay, we're using all these different chemicals on our skin. What impact does that have on the skin? But I guess we have an increasing understanding, say over the last couple of decades, that we also have a living ecosystem on the skin, just like we've got the gut microbiome, we've got the skin microbiome. And I guess we're also increasingly advancing our understanding of how these various products interact with those microbes on our skin as well. And I've also seen this trend online, which I guess I sort of am sympathetic to, of this skin fasting or skin detoxing, where you almost give your skin a break from all of these chemicals, some of which can be quite harsh, and who knows what interactions they have with that skin microbiome. Is there any evidence suggesting that could be beneficial to have a cyclical break from any products or chemicals used on your skin?
There isn't really much evidence for that, but I think what might be happening and why I still think it's a good idea for a lot of people is because of that skincare hype. Like there are so many people who have just started like 15 different products at once, and chances are only like 2 or 3 of them are actually working. So stopping all your products and then slowly adding them back in one at a time allows you to see what's actually working, so you can save time and money when it comes to knowing with like having a skincare routine. Like, I mean, we're in a recession, right? Or we're heading towards one. A lot of us, like, we don't want to spend more money than we need to. It's a really good idea to just do that sort of reset just to check, are my products working? Or also, are they still working? Maybe they were working a year ago. Maybe my skin's changed. Maybe I've moved to a different place where I have different environmental influences on my skin. So it's always good to check that just to stop for a while. Now, with the microbiome, a lot of the research around the microbiome, especially for skin, is just not really well developed. Like it's not really far along. It's really interesting, but a lot of the time it hasn't really translated to what we can do to improve our microbiome. I mean, a lot of it, we don't even know what a good microbiome is yet. So it's really hard to say, like, use this product, use that product. I still think the best approach is looking at the clinical studies and seeing, did this ingredient have this final outcome, whether it works on the microbiome or something else? And a lot of the ingredients that do work for a lot of conditions are technically doing something to the microbiome. So benzoyl peroxide, for example, is a classic acne ingredient. It kills acne bacteria. Technically, it is shifting your microbiome to one that probably produces less acne. And yeah, it does work. So I think looking for that sort of clinical evidence, rather than trying to look too closely at the mechanism, is probably better for picking products.
Now, beyond water on your skin, is there anything natural that actually exists out there which is beneficial for your skin that someone, could use on a daily, weekly, or regular basis that is science-based?
I guess like the question is, how natural do you want to go? Do you want to like go out and pick something from nature and slap it on your face? Or are you happy to just buy a product that has natural ingredients? There are tons of naturally derived ingredients or nature identical ingredients. So they might be synthesized in a lab, but they're the same as what you find in nature that have benefits like vitamin C, vitamin B3. Those are made synthetically, but they are the same as what's in nature. It would be really expensive if they tried to like get it from oranges or something. So yeah, those are very, very beneficial. Those are great for skin. If you're going for something that's more, I guess, like pure, I guess less processed. A lot of oils can be really good as moisturizers. So I think we've all seen the beef tallow trend. Some people find that helpful, and that's great if it works for you. But for a lot of people, it is probably pore clogging. But there's tons of other oils that work, like sunflower seed oil. I know there's so many people who hate seed oils, but all the clinical studies show that seed oils are actually fantastic for your skin because the thing that all the seed oil people hate, the linoleic acid, it actually gets turned into ceramides, which are correlated with less dry skin and also, I think, less acne as well. So yeah, linoleic acid, it turns out, I mean, it's an omega-6, like it's one of the essential fatty acids. Like we actually need it in our skin to keep our skin from falling apart, essentially. Apart from moisturizing, I guess there's like a few things like, I know some people like aloe vera. I personally think that it's a little bit risky a lot of the time. A lot of these things, like, because they're not pure. So I think with aloe vera, the outside, the latex, like on the inside of the outer green part, that can actually be an irritant. So yeah, sometimes it's a bit risky. There are a few things like I think masks are generally quite safe. So just put it on your face for 5 minutes and then wash it off. So yogurt is quite popular for moisturizing. Oatmeal can be handy. Like oatmeal is like a really nice traditional treatment for like chickenpox if you have an oatmeal bath. And that's because there are substances in oatmeal that are quite soothing called avenanthramides. Kiwi fruit can be a good exfoliant as well as pineapple. So these have enzymes in them that are the same ones that tenderize meat. They also help your skin cells detach. So yeah, there's a limited number, very limited number of natural things. Most of the time it is safer to buy it in a finished product.
I think in this world of skincare, particularly where there's so much hype and sensationalism, thank you for bringing some sanity and science behind it to help people navigate that. Thank you so much for giving your advice and evidence-based stuff to kind of clamp down on misinformation, Michelle. Thank you so much.
Thanks so much for having me. This was an absolute delight.
Thanks again to Dr. Michelle Wong. Next episode, we meet gut health expert Dr. Austin Chang as we dig into the rising issues of irritable bowel syndrome, IBS, what the gut is actually doing inside our bodies, and the steps that you can take to solve all sorts of gut problems. Subscribe so you don't miss that and the weekly Dr. Karan Explores podcast, but otherwise, I'll see you greasy muffins next week.